Yeah, trendsetter, whoa, league of my own, it don't get better. No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center, hit it dead center. Bullseye, hit it the most, there's no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter, total.
Good evening, everyone. My name is Dr. Ivanka Fernandez. On behalf of Drools, we are delighted to have you all join us for today's webinar. It is organized by Drools in collaboration with the Indian Association of Veterinary Dermatologists, the IAVD. Thank you all for taking time to attend this webinar today. To start, we have Dr. B. Nagarajan, the president of the IAVD, taking us through an overview of today's session and delivering the welcome address. Dr. Nagarajan, over to you.
Hello, good evening to everyone. On behalf of Indian Association for Veterinary Dermatology and our knowledge partner, I welcome all of you for this wonderful webinar. See here, today we are going to have some important topic, that is pruritus in dog with a special emphasis on atopic dermatitis. So that is the topic. As you know, we have a lot of pruritus cases, but we blindly treat with antihistamine and steroid. So finally, it is going for some other issue. Say if you go for the steroid constantly, what will happen? It will go for Cushing, isn't it? So it is very important to identify the problem earlier. What is the reason for pruritus? And in that particularly, all the time we have problem with atopy cases, because first and foremost thing is we have to identify the atopy properly, and then we have to go for a multimodal approach. That multimodal approach, we have to go in a individually tailor-made approach. So that is a very important thing. So this is a important topic. So we want to have a this thing webinar, particularly with the expert, particularly Dr. Ambily, who is assistant professor, who is a faculty from Kerala Veterinary College. So she has done a lot of work in this atopy. She has guided some PhD student also in atopy. So she has got a vast experience. She is going to deliver the lecture with her experience, and what best we can know from that lecture, we can adopt, and we can go for a proper treatment. That is what, apart from this, I invite you all for our Pune event that is going to happen on 13th to 15th in the Hyatt Regency. That is our Indian Congress of Veterinary Dermatology, 4th Dermatology Congress is going to happen. So I welcome all of you there. Over to Drools team for introduction of our Dr. Ambly.
Thank you so much, Dr. Nagarajan. Before we start, I'd like to request everyone, I have pasted a Google form into the comment section. Please fill that Google form to appropriately receive your certificates for this webinar in the correct format. Please note that if you do not fill the Google form, it will be difficult for us to reach the certificates to you. So a request is that I've dropped in a Google link into the comment section. So please do fill it so that you receive your certificates for today's session. Now it's time to introduce our esteemed speaker, Dr. Ambily VR. Dr. Ambily is an assistant professor at the Kerala Veterinary and Animal Sciences University with over a decade of experience in academics and clinical research. She established a dedicated dermatology unit for small animals and has received multiple accolades, including the Dr. CKSV Raja Gold Medal for her doctoral research on canine atopic dermatitis. Dr. Ambily has presented her work internationally and will represent India as an SOS speaker at the WCVD, which is the World Congress of Veterinary Dermatology in Boston this July. Dr. Ambily, thank you for agreeing to be with us and speak to us today. Now I hand it over to Dr. Ambily for her expert insights.
Thank you for the introduction. And good evening, all. And today's topic is pruritus in dogs with special emphasis on canine atopic dermatitis. And as you know, canine atopic dermatitis is a complex and challenging disease, not only for the dogs who suffer from it, but also for the owners and the veterinarians who strive to manage it. It's a chronic inflammatory condition caused by the interaction of genetic and environmental factors, which means its presentation and severity can vary significantly based on geographic location, climate, and even the dog's lifestyle. That's the reason why, despite ongoing research worldwide, CAT continues to propose challenges in diagnosis and management. In today's session, I'll be sharing insights drawn from our own experiences and research, particularly those that reflect the realities of our region. I hope this observation will guide you for better clinical outcomes in your patients. Is it okay now?
Yeah,
Yes, Doc, you can go ahead.
you can go.
Pruritus, is an unpleasant sensation that triggers the urge to scratch. It affects about 25% of dogs globally, with 10% being linked to atopic dermatitis. And understanding the pathophysiology of itch is for acts as a pipeline for more targeted therapies. And itch is mediated by two major neuroimmune pathways: the histaminergic pathway, primarily involved in acute itch, and the non-histaminic pathway, which dominates in chronic itch, such as atopic dermatitis. In allergic dermatitis, immune dysregulation leads to the release of pruritogenic cytokines like IL-31, IL-13, and so on, which sensitize the sensory nerve endings in skin, creating a neuroimmune loop that perpetuates chronic itch. Antihistaminics have little efficacy in chronic itch conditions like atopic dermatitis, as they do not target key cytokines. Even then, first-generation antihistaminics like hydroxyzine are still sometimes used for their sedative effect, reducing nighttime scratches and all. And these are the common causes of pruritus in dogs. In our study on allergic dermatitis in dogs, the highest occurrence was observed with flea allergy dermatitis, followed by atopic dermatitis, contact allergy, and food allergy. This finding is contrary to a study based in Jammu in 2015, where atopic dermatitis was the most common among allergic dermatitis in dogs. The variation may be attributed to difference in microclimatic conditions, which can influence allergen exposure and parasite prevalence. Regarding the diagnostic aspect, we should have a systematic and stepwise approach in diagnosing dermatological conditions, especially in dogs presented with pruritus. We shall begin with the detailed history sheet, and this is where we gather crucial information like onset of illness, duration, food habits, seasonal patterns, environment, previous treatments, and their outcomes. Mostly it helps identify triggers or patterns. A thorough history often gives us clue towards diagnosis. And next, move on to complete physical examination. Inspect entire body for lesions, alopecia, erythema, or excoriations, and palpate lymph nodes and assess general health. This helps us identify any visible lesions, signs of cell trauma, or systemic illness. From there, we can rule out the systemic disease also, and like diseases that mimic skin issues like endocrine disorders or internal infections. For example, diabetes mellitus is increasingly seen in dogs nowadays. In diabetes, poor perfusion can result in itching and rashes in skin. Mostly this happens in the lower areas of the body, especially in obese dogs. Then we have to look for the evidence of parasite or infections, fleas, mites, bacterial pyoderma, or fungal infections as common pruritic triggers, and that shall be ruled out. We then identify the severity and distribution pattern of the skin, and are they generalized or localized, symmetrical or asymmetrical. These patterns help guide differential diagnosis. From the pattern of lesion itself, we can rule out certain infections like flea allergy dermatitis, and this is the typical distribution of lesion pattern in flea allergy dermatitis. and the lesions are mostly concentrated on the dorsal 1/3 of the body towards the back. And recognizing this classic pattern is crucial because even a single flea bite can cause severe allergic reactions in sensitive dogs. And this is the pattern with louse infestation, and louse mostly favors the top line of the body, and lesions are concentrated on the dorsal part of the body, especially neck, shoulders, and back. And this is a pattern with sarcoptic mange, and mainly the lesions are seen in ear margins, elbows, hocks, and the inguinal region. These areas are typically less hairy and have thinner skin, making them prime sites for mite infestation. And the lesions were having a severe crusty and scabby appearance. And this is the pattern with autoacariosis. Mostly the lesions spread from the ear towards the face region, and recurrent ear infection which demonstrate a seasonality can be a sign of underlying allergy or atopy, especially in case of breeds predisposed to atopy. And this is the lesion pattern with demodicosis. The lesion starts from the face region and progress backwards, and mainly it's seen as erythematous lesion on the neck region and face region. And this with malassezia dermatitis, mostly seen in the flexural areas of the forelimb and hind limb, and even in face, neck, and the ear base. And foul smelling, yeasty odor, and hyperpigmented skin are characteristics. And once this is done, we can then prepare a list of differential diagnoses. And these are the possible differential for pruritus. And finally, with this information, we initiate the diagnostic plan, select relevant tests, skin scraping, cytology, allergy testing, culture, or biopsy based on differentials. This systematic approach ensures nothing is missed, especially in complex cases of chronic or recurrent pruritus. And regarding significance of cytology in dermatology practice, and routine cytology should be incorporated into every dermatology workshop. It is simple, effective diagnostic tool that enhance therapeutic outcomes. And despite its high value, only 41% of dogs presented for pruritus have cytology performed during their first visit. And barriers to cytology include cost, time, and the lack of veterinary expertise in interpreting results. And these barriers can be overcome by the new AI-powered tool VetScan Images, that is a product from Saltus, and that provides accurate in-clinic cytologic diagnosis, and it identified yeast, bacteria, and inflammatory cells from smears and swabs. It is especially useful in clinics with limited cytology expertise, improving diagnostic accuracy and patient care. And coming to atopic dermatitis, and as per International Committee for Allergic Disease in Animals 2015, atopy is defined as a genetically predisposed inflammatory and pruritic allergic skin disease mostly associated with IgE antibodies directed against environmental allergens. And this definition is updated in 2023 as it is a hereditary, typically pruritic and predominantly T-cell driven inflammatory skin disease involving interplay between skin barrier abnormalities, allergen sensitization, and microbial dysbiosis. And this new definition highlights the multiple factors involved in the disease, and which supports the recommendation that the management of canine atopic dermatitis must be multimodal. Regarding the practical guidelines in diagnosis of cat, first of all, we have to rule out the pruritic disease with similar presentation, then interpret history and clinical features using Favreit's criteria. And this Favreit's criteria developed by Favorite and coworkers, and it's a set of 8 criteria, and Favreit's criteria serve as a valuable diagnostic aid for canine atopic dermatitis. These criteria are based on history and clinical signs commonly observed in atopic dermatitis. As per the criteria, a clinical diagnosis of cat can be made if the dog satisfies at least 5 out of the 8 criteria after ruling out other pruritic diseases. As per this criteria, if 6 or more criteria are satisfied, diagnosis of cat can be made with 89% specificity. And if 5 criteria are fulfilled, the specificity is still acceptable at 80%. As number of criteria satisfied increases, we can diagnose the disease with more specificity. This approach is especially useful in general practice where advanced diagnostic may not be readily available. And in our study, only 72% of the animals were screened positive for Favreit's criteria, and the remaining cases scored below 5 and negative for this Favreit's criteria. And the probable reason may be error in reporting the history of onset of disease by the pet parent, usually happen when the dog was presented at an older age. Another reason being pruritus of non-dermatological or unknown origin. And 100 dogs, 100% of animals in the study fit to the criteria glucocorticoid responsive pruritus, and 85% fit to the criteria under 3 years of age and dogs living mostly indoors, and 93% had lesions on the front foot. And regarding estimation of serum IgE, earlier it was considered diagnostic, but now it's considered not significant as many healthy dogs may show elevated IgE levels. After making a diagnosis with favorites criteria with exclusion of other pruritic disease, we can record KVASU score and pruritus score for assessing the severity of lesions for therapeutic response evaluation. And this is the KVASU score sheet. And KVASU means canine atopic dermatitis extent and severity index. And see, this is a validated scoring system for canine atopic dermatitis developed by Oliveri and co-workers in 2015. In this scorecard, 20 body regions were scored for 3 lesions, namely erythema, lignification, and excoriations from 0, that is mild, to 0, no lesions, to mild, moderate, and severe lesions. And the total score was calculated by adding the scores of all the clinical signs, and the disease severity can be categorized based on KVASU scores as mild, moderate, and severe. And currently, the scale was internationally accepted as the latest tool for evaluating extent and severity of skin lesion in atopic dermatitis, both in clinical research and practice. And these are the body regions scored as per KVASU scorecard. And we can very well use a dermatoscore to assess the erythema severity, and we can grade it. And this is the distribution of skin lesion in atopic dermatitis. And these photographs we have taken from our dermatology unit itself. And majority of animals, that is more than 90% of animals in the study diagnosed with cat had lesions on front and hind paws and right and left flexural areas. About 70 to 80% had lesions on right and left elbow and ear pinnae and the lips. Lesion may also extend to the thighs, though less frequently. Other body regions like the flanks, lateral thorax, groin, anorectal area, and ventral tail tend to be less commonly affected. And out of this scorecard, additionally, erythematous lesions of different grades was common in ventral neck in almost all the animals. And erythema is the most frequently observed dermatological lesion accompanied by lignification and excoriation. And a consistent clinical sign reported by the owners is foot licking, which often correlates with the site of major discomfort. And coming to pruritus visual analog scale, this is an objective measurement of intensity of pruritus. It scores from non-itchy 0 to 10, means extremely itchy. And one of the major characteristics of atopic dermatitis is lesional pruritus at onset, and about 80% of animals in our study population had lesional pruritus at onset. Moderate itching is recorded in 43% of animals diagnosed of cat, followed by severe itching in 40% and mild itching in 17%. And regarding breed predisposition, that may also give a clue towards diagnosis. In our study, higher incidence of atopic dermatitis was noticed in Labrador breeds, followed by other breeds such as Beagle, Pomeranian, Shih Tzu, Pitbull, etc. And there are reports that even breed predilections for this disease may vary with geographical location. And more than 50% of the dogs with atopic dermatitis in this study belong to Labrador breed, and this might be due to the genetic risk factor together with our presentation of these breeds to the hospital. And coming to hematology and serum biochemistry, and normally we assume that routine hematology has little relevance in dermatological conditions. But in case of canine atopic dermatitis, this assumption doesn't always hold true. Leukocytosis with neutrophilia is commonly observed in atopic dogs. This finding is clinically significant for 2 reasons. First one is its help in deciding whether antibiotic therapy is warranted, especially in this era of antimicrobial resistance. And secondly, the neutrophil to lymphocyte ratio, NLR ratio, serves as a useful indicator of systemic inflammatory response and can be monitored to evaluate therapeutic response over time. Systemic inflammatory response in atopic dermatitis were documented by many researchers around the globe. And many atopic dogs also present with mild to moderate anemia, which if uncorrected may impair skin perfusion and wound healing. Addressing anemia is another supportive measure in managing these cases. And Regarding serum biochemistry, serum total protein and albumin levels also warrant attention. It may decrease due to nutritional impairment resulting from general weakness arising from severe dermatitis and excess utilization of dietary proteins for globulin synthesis. And any deficiency in these parameters should be promptly corrected as they play a key role in maintaining the skin barrier function. And regarding estimation of serum IL-31 levels, though it is a biomarker closely linked with pruritus and inflammation in atopic dogs, IL-31 measurement is not recommended for routine clinical practice. This test is costly and often unnecessary, especially since IL-31 levels show a high correlation with KVASU scores at every stage of treatment. In a typical clinical scenario, monitoring clinical improvement using validated scoring system like KVASU is more practical and cost effective.
Madam, please speak slowly, ma'am.
It's okay. Sorry for intradermal allergen testing, or it's one of the cornerstone diagnostic tools in identifying environmental allergens responsible for atopic dermatitis in dogs. It is used to identify environmental allergens primarily to guide allergen-specific immunotherapy. It involves injecting small amounts of allergens intradermally and observing skin lesions, skin reactions, typically wheal and erythema, after 15 to 20 minutes. A positive control, histamine, and a negative control, saline, help validate this test. It helps identify key allergens like pollens of different plants, mites, molds that are triggering flare-ups. It is important to note that medications like corticosteroids and antihistamines need to be withdrawn well in advance to avoid false negatives. And coming to in vitro serum allergen testing, it is a non-invasive method requiring a serum sample for diagnosis. It's a costly affair and it is an ELISA-based test. It's not sensitive or specific compared to intradermal allergen test. It's need region-specific allergen panel for improving the specificity of results. Currently, we are not getting these tests in India. We can outsource from Spectrum Lab, CVAS. And in our study, these results of in vitro serum allergen test reveal 100% of the animals were sensitive to grass mix, weeds, and pollen grains of mulberry tree, and whereas 68% to pollen grains of acacia tree and 44% to house dust and house dust mites. And coming to the key contributing factor towards development of atopic dermatitis, that is defective skin barrier function. And skin barrier function can be assessed using the epometer or theometer, which measure the transepidermal water loss. Transepidermal water loss measurement reflects the permeability and integrity of skin barrier. Healthy intact skin acts as a barrier, limiting the loss of water from the body. Damage or dysfunction of the stratum corneum leads to increased transepidermal water loss. Higher transepidermal water loss values indicate compromised barrier function. And evaluation of structural changes in the skin can be done by skin biopsy and histopathology evaluation. Histopathology evaluation of the lesional atopic skin revealed epidermal hyperplasia. You can very well appreciate epidermal hyperplasia here and the orthokeratotic hyperkeratosis. And here you can appreciate clear spaces that is due to edema and the dermal edema and intracytoplasmic, intercellular as well as extracellular edema. It's a common occurrence in case of Labrador breeds. And here you can very well appreciate the infiltration of inflammatory exudates into the dermis. And here it is the multiple thrombi that indicates congestion. And here also, breed-wise variation occurs in normal skin of dogs, which also reflects in histopathology. And Labrador breeds hyperkeratosis with focal spongiosis is observed as a common occurrence. And here, this is a histopathology slide of a beagle dog. And here, the epidermal hyperplasia is characterized by prominent reti ridges. This imaginations of this epidermis. This is a non-lesional skin with no prominent reti ridges. And here you can see the loss of continuity of the skin. This is suggestive of excoriations or indicate excoriations. And here you can see pigmentation, that is melanosis, indicative of hyperpigmentation grossly. And histopathologically, no lesions could be detected in non-lesional atopic skin in 70% of dogs evaluated for epidermal barrier defect, irrespective of the breeds. And coming to spatial staining techniques, and spatial staining techniques are done actually for confirming the observation of histopathological slides. And toluidine blue staining, this is special stain for mast cells, and this revealed increased number of mast cells in atopic skin, which is indicative of hypersensitive reaction in atopic skin. And this Mason's trichrome staining and the Picroceros red staining are special stains for collagen, and these represent dermal collagen bundles separated by clear space, indicative of edema in the dermis. And a few slides about ultrastructural studies using transmission electron microscopy, and transmission electron microscopic findings revealed varying changes in epidermis, dermis, and subepidermal areas. This is stratum corneum, and this is with non-lesional skin, and this is with lesional skin. In non-lesional skin, the corneocytes are arranged with intercellular spaces with uniform width, whereas compared to the lesional skin, here this is disorganized corneocytes with intercellular variable with intercellular space. And here you can appreciate atrophic keratinocytes with disrupted intercellular bridge. This is the intercellular bridging material. And here you can see edema, intercellular edema. This is a macrophage, the inflammatory reaction. And here you can appreciate the thin and sparse lipid bilayer, indicative of significant decrease in epidermal lipids in atopic skin of dogs when compared to normal skin. And here you can see the new, that is the melanophage with melanocytes. This melanin granules packed inside, indicative of hyperpigmentation. And this is a pycnotic, the stratum nucleus in the stratum corneum, that is disrupted stratum corneum. And coming to filaggrin as future therapeutic projects, and regarding the genetic aspects, this filaggrin gene is considered as a key candidate gene in the development of atopic dermatitis in humans as well as in animals. It encodes the filaggrin protein, which contributes to the formation of natural moisturizing factors. Filaggrin helps maintain skin hydration and integrity, and mutations in filaggrin gene can lead to reduced or defective filaggrin expression, resulting in dry and poorly hydrated skin. This compromises the skin barrier, making it more susceptible to percutaneous entry of allergens, which can trigger atopic dermatitis. Researches are going on in human atopic dermatitis regarding utilizing recombinant filaggrin to correct filaggrin deficiency. And this is a 3D structure of filaggrin protein, and we have identified a disease-causing mutation in this filaggrin protein. The mutation is identified in enzymatically active region of filaggrin, so it is highly significant also. Usually, gene therapy can be tried in hereditary disease like hemophilia, as in like hemophilia. But in atopy, the drawback or the hindrance to gene therapy is the involvement of multiple genes. So, breeding in dogs with atopy should be discouraged. And filaggrin protein deficiency in skin, atopic skin, can be demonstrated by immunohistochemistry staining. IHC staining of the lesional skin revealed faint staining of the filaggrin protein. You can see faint staining here. And when compared to the intense staining of the filaggrin protein in the normal skin as brown granules here. And this correlates with the mutation, as due to mutation, the protein deficiency is there. And even this protein, the immunostaining, can be quantified by image analysis from these IHC slides. And so this can be developed as a diagnostic modality in future. And coming to therapeutic aspects, treatment of canine AD involves a multifaceted approach with management of acute flares, suppression of inflammation, trigger avoidance, then restoration of skin barrier, allergen desensitization, and treatment of secondary infections. And coming to topical therapies, moisturizers, anti-inflammatory, antipruritic medicines, and skin barrier repairing agents are there. And moisturizers have multiple functions. The most important action is increasing the amount of water in the skin by reducing the transepidermal water loss via blocking agents or using hygroscopic molecules, for example, as in oatmeal. And improved hydration alone can reduce pruritus and decrease the need for antipruritic drugs. And certain moisturizing shampoos are commercially available, which is beneficial to lower pruritus and lesion scores. And you can use thrice daily application weekly for initial 3 weeks, followed by once weekly application. That is better for maintaining the skin barrier. Actually, that is a frequency of bathing matters rather than the products. The frequency of bathing itself relieves itching by cleansing and moisturizing, helping restore skin barrier function. And nowadays, these spotons are allerderm spotons are available with ceramides and fatty acids, and the ceramides make up 30 to 40% of the epidermis, are crucial lipids that prevent moisture loss and support barrier integrity. And essential fatty acids also enhance skin barrier function by increasing lipid content and organizing lamellar structures in the stratum corneum. And omega-3 also modulate inflammation by inhibiting cytokines, mast cell degradation, and pro-inflammatory mediators. And coming to systemic therapies, acute flares can be managed by Janus kinase inhibitors and glucocorticoids. And Janus kinase is an enzyme which is involved in signaling pathways for pro-inflammatory cytokines. This oclacitinib, that is traded as apoquil, that inhibits this Janus kinase enzymes. And this oclacitinib can be used for acute flares at the dose rate of 0.5 milligram per kg body weight twice daily for 2 weeks, followed by once daily dosage for long-term therapy. And mild leukopenia and neutropenia, then gastrointestinal side effects and hypercholesteremia are the possible side effects. And with reduction to once daily dosage after 2 weeks, there can be chance of rebound pruritus in some dogs. The addition of prednisolone at the dose rate of 0.5 milligram per kg body weight for 4 to 5 days at this stage can reduce the rebound pruritus. And corticosteroids induce suppression of genes encoding inflammatory cytokines and chemokines account for the therapeutic benefits of corticosteroids in allergic disease. Then calcineurin inhibitors like cyclosporin are available, which means and all. And the cyclosporin at the dose rate of 5 milligram per kg body weight was an effective and well-tolerated drug for treating atopic dermatitis. For long-term management, cyclosporin is even better than corticosteroids. And there are reports that supplementation of essential fatty acids along with cyclosporin or glucocorticoids could reduce the overall drug requirement and also has got a synergistic effect with significant reduction in pruritic scores. And gastrointestinal tract signs like nausea and vomiting were the usual side effects that are noticed only during the initial few weeks of therapy with cyclosporin. And even treatment with oral prednisolone resulted in weight gain and even in Cushing syndrome and all, and even topical corticosteroids and also. And so comparing the periodic remission of clinical signs and recurrence rates, cyclosporin is considered better for long-term management. And many skin diseases, including atopic dermatitis, seem to be related to gut dysbiosis, and modulation of canine intestinal microbiota is getting more attention as part of multimodal cat management. And studies have shown that oral supplements such as zinc, methionine, lactobacillus probiotics, and vitamin D have demonstrated a decrease in cat lesion index and pruritus score index when used in combination with traditional medication over time. And ilunocitinib is a new addition to cat therapy, and this is registered in the US in last September 2024, and it is beneficial over oclacitinib for long-term management. A recent randomized clinical trial comparing this ilunocitinib and oclacitinib in dogs revealed that during the initial phase of treatment, that is during first month or 2 weeks or 4 weeks, up to 4 weeks, both treatments show similar results. But after that, after 1 month, for an extended phase, ilunocitinib provide significantly better control of pruritus and skin lesions, with more dogs achieving clinical remission. And lokivetmab, available as Cytopoint, is an anti-canine IL-31 antibody. Monthly injections at the dose rate of 2 milligram per kg body weight is required, and each reduces within 24 to 72 hours. And action lasts for almost 1 month. And due to its short onset of action and sustained response, lokivetmab can be used for acute flare management and chronic treatment of canine AD. Anorexia, vomiting, lethargy were noticed in 2 to 9% of animals underwent therapy. No drug interaction with lokivetmab have been noticed. A variety of medications have been used concomitantly with lokivetmab in clinical trials, including parasiticides, antibiotics, antifungal, corticosteroids, antihistaminics, oclacitinib, cyclosporin, etc., with no interactions reported. And development of anti-drug antibodies has been reported in up to 2.5% of dogs treated with Locuvit-MAP. And regarding allergen-specific immunotherapy, is the only treatment that may reverse part of the underlying pathogenesis of the disease. And there are different routes like intralymphatic, subcutaneous, and sublingual. And the emerging one is rush immunotherapy, and it's a faster version of traditional allergen shot that aims to rapidly desensitize a patient to allergens. It involves administering allergen shots over a short period, say within a few days, rather than gradually over several months. This approach aims to reach maintenance dose faster, leading to faster symptom relief. And to conclude, CAT is a complex disease with different clinical manifestations and requires a multimodal approach. It's a non-curable disease, but lifetime management is required, and treatment options regularly reassessed and adjusted based on specific needs of patient. That is, there is no hard and fast rule for therapy. It should be customized after careful periodic monitoring of skin conditions of the patient for better management. These are my references. Thank you. And I thank Association for Veterinary Dermatology India for this platform. Also thanking Drools Healthcare for the coordination. And thank you once again. Thank you all.
Thank you so much, Dr. Ambily, for that enlightening session. Now, I would like to present to you the initiatives that Drools has for veterinary education. From educational workshops to seminars, we provide also high quality nutritional solutions. We strive to empower veterinarians with the right resources to make a difference. Our latest initiatives includes, of course, Vet Thrive, in which we provide upskilling of veterinary clinics in order to enhance the kind of care we are able to give our pets. We also, where Drools funds veterinary equipment. Macroscope is a program that we have at veterinary colleges for final year students, that is students that are either doing their masters or in the 4th and 5th year of their bachelors, to basically get them to understand the various ways in which they can contribute to the industry, and find out what really opportunities and scopes that they have before they leave the four walls of college. Also, we have the continuous veterinary education programs in association with Tanuvas currently, and that helps in vets currently in practice getting better and learning new skills that we, in coordination with Tanuvas, are able to provide. Friends, now it is time for our interactive question and answer session. If you have any questions for Dr. Ambily or Dr. Nagarajan, please drop them in the chat and I will ask them on behalf of you. So if you have any questions, please do put it in the chat box. Dr. Ambily, we have the first question. It is, what kind of diet can we give in atopic dermatitis?
So actually, this diet is so important. As itself is clearly says one of the important criteria is dysbiosis. So the dysbiosis, both microbial dysbiosis of intestine as well as the skin. So to improve the skin health, the gut health is so important. Apart from supplementing the need of the condition, say essential fatty acid for the epidermal barrier function, zinc, all other substances are required to improvise the skin health. So it is very, very important to improve the health of the intestine. So it'll be done by the food. So the hypoallergenic diet is so important. So that can be given as a important thing whenever atopy is there. What Ambly, what about yourself? Telling something?
Yes, sir. It's true. It's true. And but hypoallergen diet alone can make any positive. But together with the anti-inflammatory and customized drug, we can.
They are asking whether what type of food we can give for atopic. That is what I.
Yes, to better supplement or support patients with atopic dermatitis.
Usually, I recommend home cooked food.
Okay. Doc, so the next question is, how long can corticosteroids be used in cases of CAD? And when we are tapering the dose, how do we taper the dose of corticosteroids?
Actually, in my practice, I'm giving this corticosteroid at the dose rate of 1 to 1.5 milligrams. It's a higher dose for about a month, and after that, I'll taper to half the dose or alternate day basis.
Okay.
And then for another month it will proceed, and after that taper to once in 3 days, and like that, based on the clinical signs, clinical improvement, we are doing this tapering, and we can taper and to a dose that can be maintained for some time, that is no lesion at all, that can be maintained.
Okay, doc. Thank you. Another question from Dr. Ritvik is, what are the tests that can help us to rule out the causes of atopic dermatitis in canines?
I didn't get you, ma'am. Kindly repeat.
What are the tests that can help us rule out the causes of atopic dermatitis in canines?
Course of atopic dermatitis, only
Yes,
allergen test will work.
only an allergen test.
Actually, we have to avoid, we have to see avoiding all the causes. Actually, first we have to rule out the causes of pruritus. We have to identify by skin scraping, we have to rule out the parasites. And by tape impression, we can rule out the microbes, what is flaring up. And then we have to check the food. We have to give, we have to go for systematic way. So as initially you have to rule out the parasite, then we have to rule out the all allergies like flea allergy, food allergy. So after ruling out, so the ruling out is so important in identifying the problem. So once you are going to rule out that, if you apply the favorite et al. Criteria, as she was telling, out of 8, if it is going to be 5 positive, we can think of having the thing, provided it should be negative for skin scraping. And also there is it should not have microbes. So after clearing that only, you have to apply the favorite et al. Criteria. That is very, very important.
Doc, there is another question. Will there be a reoccurrence of atopic dermatitis even though it has been treated before?
Make your pardon? Please repeat the question.
They're asking if there are recurrent symptoms of atopic dermatitis even though it is being treated.
Actually, the main symptom of atopic dermatitis itself is recurrence. See, it has been treated with the steroid, it has been treated with the antibiotics for many number of times. So that is in a circulation, it will come from one doctor to another, they will go. Then finally, it will come back to us. Finally, what will happen? If they are not following properly, actually, that's why we have to check all the time cytology. See, the flare up, whether even though they are treating the case with the proper drug like cyclosporin, apoquel, any oclosutinib, or even any treatment for cytokines, if they are going to do it strictly following the doctor's prescription, in spite of that, if they are going to have it, we have to check for flare ups. So the flare ups is mainly with the food, mainly with the environment, say the seasonal variation. See, all of a sudden there will be a flowering season that can influence immediately. So that can aggravate the condition. So that has to be managed well, like by keeping a percolators, keeping carbon particles in the garden and other thing. Like that, we can, as far as possible, we have to control the chances of exposure. That is the thing. Apart from that, the food allergy and flea allergy has to be identified. Apart from that, by tape, we can appreciate the microbes, which is having, sometime it will have more flare up of bacteria or even the malassezia. So the malassezia, if it is going to be there, once you are going to treat it, it will get all right and it will go for control. If you are not doing it, it will be keep on recurring and it won't be having effect, and you cannot blame the drug. So it is very, very important to see the flare up each and every time when the animal is coming. And if the owner is telling it is recurring, it is still, in spite of giving the treatment, it is not improving, means we have to think of the flare ups. So you have to see whether it has got any flare up due to microbes, due to parasite, due to food allergy. So that's why we always suggest to go for this type of food, that is hypoallergenic food. That is the ideal one for this kind of atopy. Even though it is, even if it is not having food allergy, it is better to have this because that cannot flare up the condition. So that is it.
Another question, Doc, is there any difference in cats where medication is regarding? So is there any different medication when we are treating the same condition in cats?
So we have to have cyclosporin is the important thing for cat. Still, we are not having any uh, more reports on oclosutinib in cat for atopy because they are going for cyclosporin. That cyclosporin itself will be in a higher dose, 7 mg instead of 5 mg per kg body weight. We have to go for 7 mg per kg body weight. But if you know the allergen, we can go for allergen specific immunotherapy. That is the thing. Still, we are poor in identifying the allergen in each and every state of India. So we are going to do the work for it, and we are the work is under progress. After our Congress, we'll be seriously going into it. What is going on in the Indian scenario, and what is the environmental allergy? What we will list out the environmental allergy, and that will make sense for our veterinarians to follow the immunotherapy, how to, once we map out what are all the allergens in India, then we can clearly indent what type of allergen we have to indent or what type of allergen we have to use for our animal with the atopic. That will be making sure.
Another question, Doc, is other than dogs, in which species can you see atopic dermatitis in?
Other than dog, cat, definitely they will be having allergy, atopy. Feline atopy is so common nowadays because we are not having idea about it initially. Now we know it is having atopy.
Okay.
But we have a different type of insect bite hypersensitivity in horses. So that is quite commonly seen. That is also hypersensitivity reaction. But this strong immunological disturbance is not there in that. So this is a very peak immunological disturbance is noticed in atopy. That is so commonly seen in dogs and cat and also in human.
All right. And also, Doc, last question is what can we use tofacitinib, and is it economical to use tofacitinib?
So we have to have the research data. Then only we can, evidence-based medicine is so important to apply in the field. So we cannot simply follow one medicine and we will be in trouble because nowadays we have got a lot of legal issues. So it is very, very important to have the evidence-based medicine to apply. So that is the best way to solve the problem.
Thank you so much, Dr. Nagarajan and Dr. Ambily as well for this question and answer session. To conclude, I would like to invite Dr. Neelam Singh, the Administrative Committee member of the IAVD, to please deliver the vote of thanks. Doc, over to you.
Thank you, Dr. Ivanka. Good evening, everyone. On behalf of AVD, I would like to thank all the veterinarians in the audience for attending this extremely informative session by Dr. Ambily, Assistant Professor at College of Veterinary and Animal Sciences, Pookode, Kerala. Now, I'm very sure that each one of us, finds it really challenging occasionally to manage some of these itchy/atopic dogs because these days, the itchy dogs, we are seeing a lot of ratio in atopy. So which are also the bread and butter of our practices actually. So after today's webinar, we'll be able to handle those cases better and keep our pets itch-free and make the life of our patients and the pet parents better. I'd like to thank our knowledge partner, Drools, for organizing the webinar and supporting AVD immensely. I would like to thank Nagarajan sir, who has been working so hard to bring AVD onto the global level. Now, before finishing, I would like to invite you all to register for our Dermatology Congress, Annual Dermatology Congress ICVD 4, which will be held at Pune from 13 to 15 June this year. So we have wonderful speakers like every year. We have the WAVD president herself, Dr. Susan. We have Dr. Koji and Dr. Sonia Petni. Dr. Sonia is also the course master of our pre-Congress hands-on workshop on cytology and dermapathology, which will be held on 12th post-noon and on 13th morning as well. So we have very limited seats which are remaining. So interested vets, please hurry up and confirm your seats. You should not miss this opportunity to learn from the best which is actually delivered literally at your doorstep. So the last date for abstract submission and case presentation is 30th April. If you plan to send your entries, please do it soon. PG students, faculties, and private practitioners, they can mail their respective submissions. So thank you all once again, and see you in person in Pune very soon.
Thank you, Dr. Neelam. Before we wrap up, I would like to once again ask you to please fill out the form, the Google link of which I have pasted in the comment section. And thank you all once again for taking the time today out of a Sunday to attend this webinar. Wishing you a wonderful festive season ahead. Happy Easter to everyone. And we look forward to seeing you at future sessions. Thank you very much and have a good night.
My friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
or fillers.
All natural, all healthy ingredients.
It gives them the best of both, taste and nutrition.
Drools.
Drools. Drools.
Drools.
Drools. Feed real.
Feed clean.